listeners out there. We doctors are a busy set of people, mostly having either one exams or one seminar or work or surgery or something. There's always something to attend to, and usually when I call on them, it's struggle. Okay, I'm coming. I'll give you a feedback. Later on, I'm not coming. So it's
then you're left to look for another person.
Yes, or I have to come here myself. So you can see it was quite demanding, but it's worth it because whenever I come here, there's this satisfaction when people call to appreciate, when people, I've entered places here in Jos where people just when I introduce myself, they say, you are the PRO, we've been hearing your voice over the radio and all of that. So I think it's good. And then because of this, people have been willing to help me. So it's important, and it's meant so much to me. And I really appreciate the privilege and the honor. So basically my challenge were getting people to come around. Because they were all busy most of the time.
And we're happy that you were always here. I've always told you that you should be teaching somewhere.
Well, I think somehow I'm doing that already.
Okay.
Yeah, maybe that's the gist
for another time.
Or something.
Okay.
Yes.
And with Dr. Jehu this morning, we have the brand new PRO, Dr. Chanshilip Panshak John. He is of the Department of Radiation and Clinical Oncology. Good morning, doctor.
Good morning. Good morning, Plateau, and good morning, our listeners. It's a pleasure to be here.
Yeah, and it's good to have you here. So for the next years to come, Dr. Chanshilip will be the one organizing and ensuring that doctors come on the show to talk to us on any health matter. Okay, so let me ask you then, before we begin the main topic for today, how do you feel being the PRO now, and what do you look forward to?
Okay, so thank you so much again. Good morning, Plateau. How do I feel? Well, it's a privilege to be able to serve the community in this capacity, and so I'm grateful to the association, the Nigerian Medical Association Plateau State Chapter, for giving me this opportunity to serve. And so I look forward to I've heard his
more engagements,
and all, but then I'm not scared.
Yeah.
And so I look forward to a great time in this office.
Maybe his challenges could be some strengths for you.
Maybe.
Yeah.
I hope so.
Yeah, we hope so.
Yeah.
So good morning and welcome on board our day.
Thank you so much.
Okay, so today we're talking malaria prevention, how to protect yourself and your family this season. I know in the past 1 week it's been raining every day, and that means that we have more and more mosquitoes flying around. Something needs to be done. So why do mosquitoes spike during the rainy season? I'll start with Dr. Jehu.
Okay, thank you for the question. Why do mosquitoes spike? And by the way, as a way of introduction, mosquito is a carrier or the vector that transmits malaria. That's the plasmodium. Okay, so the mosquito carries the plasmodium, and then of course several species of them, and then transmit them to humans when they bite. And usually they bite to feed, because they feed on blood. Okay, so they bite humans not intentionally to cause disease, but to feed. In the process, in their saliva is contained the plasmodium species, and in the process it injects it into the human, and then the parasite in the body now multiplies. It goes through other stages of maturation and then multiplies and eventually cause disease in humans. Now mosquitoes, why
the spike,
or let me say malaria,
okay,
why it spikes at the rainy season, around this season, is because mosquitoes, if you know how they reproduce, part of their reproduction is we call it the asexual reproduction, is outside of the human body, and it takes place in moist, muddy, watery, dark corners. Okay, so during the rainy season, there's rainfall, there's water collections, gutters, water bodies all over the place. That's one. And secondly, there are grasses and bushes growing around, so there are more dark corners where they could hide. Of course, mosquitoes do not, unlike flies, who would thrive well during, with so much brightness and sunlight. Mosquitoes are the direct opposite. They will thrive better in dark corners, and these dark corners are brought about by bushes. Okay, and of course, imagine that there's a dark corner somewhere where there is collection of water body again, and this is what they want after all. So they would reproduce there, and then eventually populate, and then cause so much bites. Now, unfortunately, these grasses we're talking about and bushes, it's rainy season, so it rains everywhere, okay, including our homes. And so if care is not taken, we allow bushes around in our houses, we allow stagnant water, gutters, and all of that. Indirectly, we are promoting, or populating mosquitoes around us. So what that means is eventually we're going to have a rise in the case of malaria. So the season usually, if you notice, even from the trend of things in our previous discussions, a few months ago we were here to talk about Lassa, that pikes around
harvest time,
December to April, and then eventually we came and talked about cholera, when we had outbreaks. Okay, we had outbreaks in some parts of Plateau State. So you can see that most of these diseases are seasonal, and then there are certain factors that we must put into consideration. And in the case of malaria, the factors to consider is the rains. Okay, if you go to other parts of Nigeria where it rains almost throughout the year, they would have more cases of malaria than we would have, ordinary. Again, if you go to other parts of the country where perhaps the rain isn't that much, but then there's the warm environment, it also promotes the growth and reproduction of malaria. So basically, we have seasonal variations, and then of course having in mind the weather and climatic factors put together would give us a rise, especially around June, July, August. So. Okay,
Dr. Chanshilip, you want to add to what he said?
Well, just to summarize what he basically said in, let's say, 3 sentences. The first point he raised is actually about the timing. So usually temperature is a factor, right? So temperatures between 20 degrees to 30 degrees, when the environment is within that temperature, it causes the mosquitoes to thrive well, and then also the parasites to go through each stage of maturation well. And also he talked about humidity. So we're talking about moist environment and all. So during the rainfall, the place is usually moist and all. And so he talked about also our environment, the dark places he mentioned. So we leave bushes around, which and then there are a lot of pools during the rainfall, which helps this the mosquitoes to thrive. So just as a summary to what he has said, really nothing to add to what he has said, because he has said everything.
So would want to know, are there malaria in every part of the body, or it's just, I know there's cerebral malaria, am I right? Is it the same thing as the normal malaria, and what could cause that?
Okay, so when you go into cerebral malaria now, you're talking about the types of malaria. Yeah. So there are different types of malaria, and then we're talking about severity now when we talk about the types.
Okay.
Right. So cerebral malaria is a severe form of malaria, and that is quite dangerous, and you see that usually in children. So that is why you advise that for children, you don't want them to be exposed, because they are prone to having these kind of cerebral malaria that can cause a lot of damage to them. Children, they are in this early stage of development. The brain is still developing and all, so you don't want anything to damage the brain, because it will cause problem in the long run to them. I mean, intellectual problems actually. Yes. So, but there is simple malaria, right? And there is complex malaria as well. So those are just definitions of malaria, but they are all caused by mosquito. By mosquito. Well, not really mosquito. When we say malaria, it's not caused by mosquito. Mosquito carries the parasite. The parasite is Plasmodium, and we have different species of Plasmodium. So we have the Plasmodium falciparum, we have the Plasmodium ovale, we have the Plasmodium vivax, and then we have the Plasmodium malariae. So all these, they are different types of parasites. Well, the most common one here in the environment that causes the common malaria is the falciparum, and that is what, when you test on the rapid diagnostic test, it only tests for falciparum actually. So that means in some context, that rapid diagnostic test may be limited because it cannot test for the other species of malaria. And also, it suffices to say that the severe form of malaria is usually caused by, there are some other, I think it's the ovale, that is caused by, the severe form is caused by that.
Okay.
Yes.
Okay, Dr. Jehu, when you go for a test, they will say it's plus, malaria plus. So that means that malaria is in stages. At what stage can you say it's plus, and then all the other stages?
Okay, like my colleague here stated, malaria is classified, or types of malaria based on severity. There's simple, uncomplicated malaria, and then there's severe malaria. The criteria that is used to classify this are usually the clinical symptoms and the laboratory symptoms. Okay, so for the clinical symptoms, we have symptoms as maybe severe anemia. Anemia again could be both laboratory and clinical. Okay, when we have a child that is convulsing because of malaria, automatically that's severe malaria. Okay, when we have other things like kidney injury, we have other things like severe vomiting, okay, and then severe lethargy, okay, prostration and the rest of them, okay, they are severe malaria. Then laboratory now, the question is plus, right? Now, it's when we, like I mentioned, I say we classify either based on clinical features, which I mentioned, the convulsions, the vomiting and the rest of them, or based on the lab findings. And then the lab findings, what plus means is there's a certain number of the parasite that has been counted under the microscope. Okay, so when we have values less than 10, okay, is 1 plus. We have 10 to 100 is plus, and above that is plus. Okay, so now this does not necessarily translate to the clinical features. There are people who would have 2 pluses and they don't have symptoms. Then another person has
just one
plus and is severely sick. Okay, so usually we marry these symptoms together with the laboratory findings to come together and make a conclusion and an impression, and then see what to do. I also wanted to add again when he was saying that mosquitoes carry the mosquitoes are not actually, like he said, are not the guys that carry the disease. They carry the parasite that causes the disease. Now, not even all mosquitoes. Okay, specifically we call them the female Anopheles mosquito, the species of mosquito. Okay, so they carry the parasite. So not all mosquito bites necessarily translate to malaria. Okay, what if it's the male? Okay, what if it is not the Anopheles mosquito? Okay, and then what if it is just a bite that, let's say, sorry to say again, the definition is an infected female Anopheles mosquito. There might be a female Anopheles mosquito that is not even infected. So you can see. So not all mosquito bites translate to malaria. But of course, you and I do not know which of the mosquitoes.
Exactly.
So it's better to prevent and avoid the bite in all cases as much as possible. So I don't know if I've answered the question.
Yeah, you did. Okay, Dr.
Yeah,
Chanshilip.
just to make a comment on that. Sometimes you see some funny results. So there are 2 tests that we do, and I made mention of the rapid diagnostic test, which is the RDT, that you can just prick someone and then just get the result within few seconds or minutes. And then there is the microscopic test that you do. So for you to classify based on this plus and plus, you have to prepare a blood film on the slide, look under the microscope, and then count, as he said. So many places don't do that, and they just report the rapid diagnostic test as plus or plus, which is very wrong. You understand? The rapid diagnostic is either positive or negative.
Okay.
All right.
Yeah.
All right. So we would look at the symptoms now. Most times you hear people have fever, and then we just assume it's malaria, and then we go get some drugs.
Or malaria typhoid.
Exactly, malaria typhoid. Yes, that is trending. I have malaria typhoid. So what are the early warning signs of malaria people often ignore, and at what point should someone go to the hospital?
Okay, the symptom of malaria at the beginning usually would not be specific. So it's just that malaria is an endemic disease in this part of the world, and that's why commonly people just say we have malaria. Okay, it might not actually be malaria. And then the symptoms again may vary from one person to the other, and then they would vary again from between age groups. Okay, take a child for instance. If a child has malaria, the symptoms commonly would be fever. Okay, that's the first symptom you would actually notice. Usually fever.
That's in a child.
Yes, fever and poor feeding. Discover the child is not feeding well. The child is febrile. His body is hot. He's vomiting. His diarrhea. He's having diarrhea. Some, coughing. They are just non-specific. Okay, and then you discover that they are weak. A child who usually would play with his age mates and thereabout, other kids, he's no longer playing. He's just sleeping, or he's seated one side and all of that. So in severe cases, then you see the child convulsing. Okay, and then convulsion could come from either ways. It could come from the parasite itself, or it could come from the fever, because fever, very high temperatures in children, would cause convulsions for them. Okay, so usually either ways, so that if your child is having fever, or if your child starts convulsing, you don't automatically say it's because of malaria. It could just be that he is having fever from another illness. Fever, of course, many other things can cause fever. Okay, now in adults, the symptoms may not exactly be the same. You would not commonly see convulsions in adults, but you would see headaches. You see people telling you they have headaches. You see people telling you they have fever. And the fever in malaria, it's what we call intermittent high-grade fever. It comes around a certain time of the day, and after a while it goes. Commonly in the evening, you see people tell you, I came back from work and I have this headache and fever in the evening. Then he sleeps and tomorrow he's fine. Goes about his regular activities. In the evening, the fever comes back and headache. So it's called intermittent fever. It's usually high grade and it's intermittent. And other symptoms would include joint weakness, joint pains, body weakness, headaches, like I mentioned. In some cases, you would have vomiting. Okay. Now, in severe cases, okay, you may even have kidney damage. Now, that's where we begin to have symptoms like facial swelling, leg swelling. They call it black water fever. Okay, where you see people passing urine that is as dark as Coca-Cola. Coke that we used to take. You see somebody's urine is that dark. Okay, that means it's already a kidney injury because of the malaria. Oh. Surprisingly, I have seen one case like that. Okay, so you would wonder. Now, suffice it again to say that malaria is a very serious illness. Okay, there are people who have died mysteriously, and it was malaria. Okay, we a while ago we carried out an autopsy, and we got some findings in the patient from malaria. It was so surprising. I am telling you, it is so surprising. It's a multi-systemic disease. It can cause a lot of damage to the body beyond what one can imagine. Okay, and then sometimes it even hides in the body. You don't even know it is the one causing all of that. So the symptoms would not necessarily be 100% specific. Okay, remember we were here to talk about Lassa fever the other time, and we said that these symptoms may even look the same. It is usually towards the end of the, as the disease advances, that the clinical features begin to vary, where you begin to have frank blood in urine, nose bleeding and the rest of it. You know that this is not malaria anymore. Okay, but usually advisably. The question, the B part of your question is, at what point should people go to the hospital? Go to the hospital as soon as you have symptoms. Don't wait. Some people treat. They will treat first. When they treat, they will go to the lab. Some of the lab, like he rightly mentioned, are not even well certified. They do an RDT. Maybe they didn't even, because even the RDT has specific, it's a strip test. You put the blood, you add a buffer. You are supposed to observe for certain number of minutes. Some don't wait for those minutes, they read. Some wait until it goes beyond the minute and then they read the result, which is not appropriate. A well-trained laboratory technician or scientist should be able to do it appropriately, to run the test appropriately and give a good result that can be interpreted well. Suffice it again to say that this strip test has up to 90 or 95% sensitivity. Sensitivity means it has a 95% chance that if the disease is there, actually it would pick it. Okay, so the strip test is meant to be reliable. Unfortunately, people mishandle. Some even dilute the buffer, with water. And then, so you can see a lot of things are going wrong that we may not.
Yeah,
so
some people just end at the pharmacy. I think they do the strip test there and then.
Yes, some will just go to the lab.
There. Yeah.
I've seen people, at the point I had to drive some people away. They go to the lab, tell the lab person, run for me a test of malaria. He runs the test, they now bring the results and say, doctor, prescribe for me. But then the question is, what were your symptoms? What if it was something else? Okay, because doctors have been trained to put one or two together. You put one or two symptoms together until they make sense and point you towards a diagnosis. You just you have jumped a step and then you are now putting us on a fixed.
Jumped steps.
Yes, and then some even go as far as just going to the pharmacy. We're not saying it's wrong to go to the pharmacy, but get a prescription and go there. Okay, they just go to the pharmacy and give me anti-malaria. Pharmacy, who no one sell market? Drugs now. If you want drugs, I will give you drugs. After all, you are not buying what is contraband. So
exactly.
Okay. So you are promoting businesses of others at the detriment of your own health. Forgetting that every drug is a potential poison. So it's important that people understand this and act appropriately.
Okay, let me hear from Dr. Chanshilip. Chanshilip, then I ask the next question. You were smiling, it's like you wanted to say something.
Okay, yeah, I mean, there are things, but I will just limit it because of time. So he talked about fever, and one thing I've noticed is that it's like many people don't even know what fever is, because everyone comes, do you have fever? Yes. Oh, I have fever. What is fever? My tummy is turning or something like that. So I just feel I should maybe tell people what fever is. So normally, if you have fever, your body would be hot. You know, most times your body will be hot, and then sometimes, like for malaria fever now, it can come with these chills. You just feel chills over your body, and then some people are even shaking, rigors. We call them rigors. So you see the child shaking, shivering. So classical of malaria fever, and as he said, it is mostly intermittent, mostly towards the night. So the person is sick over the night, is shivering and having all those rigors, but in the morning the child now goes to play as if this is not the person that was sick. So that's how intermittent it is. And then the second thing I want to emphasize on is the points that you asked. You asked when, at what time should people go to the hospital, and he rightly answered it. Immediately, as soon as you start feeling anything, go to the hospital. And I just want to correct this attitude that we always have. You know, people just fall sick, maybe they feel something, and they just go straight to the chemist or pharmacy and get medications. That is very wrong. Or they go to the lab and just run tests and send it to their doctors in their DM. Whenever I see that, the kind of rage that comes
Dr. Jehu said he chases them away.
Yeah, sometimes I don't even reply that, because why would you do that? It's wrong, totally wrong. We have primary health cares. If you think going to a tertiary institution or secondary institution is too big for you, you have primary health cares. They are trained people that handle malaria and other conditions well. You go there, lay your complaints there, the person sees you, and then he requests for test, and you do the test, and you will get the prescription. That's the correct way to seek health, not to go to labs and pharmacy first before coming back to your doctor. That is very wrong. So I just want to emphasize on that point. Please, whenever you feel anything, go to your doctor or to the primary health care first. Lodge your complaints there, and then you get tested and you get your prescription.
It's always like people jumping protocols.
Exactly.
Instead of starting with the doctor, you make the doctor the last option. Okay. Would have to go on a break. This is Good Morning Plateau, Peace FM 90.5. This morning's edition is sponsored by the Nigeria Medical Association, and I have with me in the studio Dr. Ayuba Namang Jehu of the Department of Anatomic Pathology and Forensic Medicine, and Dr. Chanshilip Panshak John of the Department of Radio and Clinical Oncology. Both of them are from Jos University Teaching Hospital. One is outgoing PRO and the other is incoming PRO. We'll take a break, and when we return, we'll take a few more questions, and it will be your turn to be part of the conversation. Stay with us. Welcome back to Good Morning Plateau on Peace FM 90.5. I am Inga Samuel, your host for this edition, and we have been looking at malaria prevention as the rainy season, reaches its peak, and of course, this means that malaria will be at its peak as well. We've looked at why malaria peaks at this moment, and of course also looked at signs and symptoms of malaria. We would also want to know, I know while growing up, we had chloroquine as malaria treatment. After a while they told us that the body system was resisting that, and they came up with some drugs again, and now it looks like we're going back to chloroquine. So let's look at drug resistance. Why is malaria resisting treatment?
Okay, drug resistance is when an organism evades the deleterious effect of drugs that are used ordinarily to kill that organism. Okay, let's give an example with the malaria we're talking about. Previously, when we were children, it was chloroquine that was used to treat malaria. Okay, over time, due to adaptation, okay, humans adapt. Okay, we adapt to climate change, we adapt to a lot of things. Likewise, every other thing that God has created under, the heavens, they also adapt. Okay, if chloroquine was used to kill them, they would adapt to maybe undergo certain mutations, and then they undergo gene reconfiguration. Okay, so the genetic makeup changes. Remember that these drugs were used, or they were produced with the genetic makeup of the previous organisms already. So now with the alteration in the genetic makeup, there has to be a corresponding alteration in the medications. Otherwise, they will not respond to the previously used medications. Okay, and this is a common problem. Okay, not just for malaria, but for most other diseases, including cancer. Okay, yeah, including cancer, including bacterial infections, viruses, parasitic infestations, and the rest of them. Okay, now why do we have this resistance? Okay, the actual mechanism for resistance is not fully understood. However, it has been postulated that when people take drugs, okay, you take drugs that is meant to kill the bacteria or the parasite, and then the parasite gets injured and your symptoms resolve, then you discontinue the medications. Okay, meanwhile the parasite was not dead, it was still there. It's just that it has suffered some injuries, and then now you have
to heal.
If you withdrawn the medication, now it heals. It may heal with a change in its makeup. It may not heal the way. It's just like when you have an injury, you have a cut on your hand, it heals with a scar. That scar is no longer the normal skin. It's no longer the same. It has changed, the configuration. So that is what happens in resistance. Okay, the configuration of that organism changes. You know, like somebody enters your house and then you wound the person, and then he faints and you relax and celebrate, and then he gets up again. You think he's going to take it lightly?
You become more defensive.
You become more angry, and then so you can see how this happens, and this happens for many medications. Okay, and that is why it is important we keep emphasizing the concept of drug adherence, drug compliance. The moment you start the medication, please complete them. We understand that these medications would have side effects, but of course most medications that would cause such side effects, you don't take them for long. Malaria medication, for instance, you take them for only 3 days, at most 6 days. as if you would have to take the complete therapy with injections and then the tablets. So you can see that it's a very big problem. Now, recently, resistance to malaria have been reported in parts of Asia and in parts of Africa, of which Nigeria is among. Currently, there are even very serious researches ongoing, okay, to unravel this whole concept of resistance and then to also unravel possible new drugs, okay, for the treatment of malaria. But I tell you that we have very high rates of resistance to malaria therapeutic. So we have a lot of drugs that are not effective anymore. And of course, these drugs evolve as a result of resistance. Okay, in years past, like I mentioned earlier, even before we came on board as children, or we came to be, it used to be quinine. Okay, almighty quinine.
Yeah,
it is one of the most devastating drugs you can take. I tell you this. Okay, but even the quinine still has some resistance. Okay, and it's not even all over the place, and the side effects are undesirable. I bet you will not want. I have taken it myself, so I know how it feels. I bet you will not want to go to that, extent of taking quinine. Okay, now quinine was eventually suffered resistance. Now chloroquine came to suffer. Eventually, even the other ACT, okay, artemether-lumefantrine, artesunate amodiaquine, artemisinin piperacin, all of them, they are ACT based. Okay, they are artemisinin based combination therapy, and they are suffering resistance as well. Okay, so it's important that we understand that this is what caused the resistance. And then when we take medications, we take, funny enough, this resistance, if I misuse drugs, and then the parasite in my body gets to be resistant, and supposing a mosquito bites me, and then picks up this parasite, and then goes to bite another person who does not misuse drug, the mutated parasite that is already resistant in my body will be transmitted to that person, and the person suffers the resistance. So you can see. So if you don't want to protect, if you think yourself, you can sacrifice yourself. I mean, protect, the whole environment, protect everybody else by doing as much as you can to adhere and to comply with the prescription of your drugs. Thank you.
Okay, all right. Dr. Chanshilip, you want to add before we begin to pick up our calls? They are already calling. Okay.
Okay. So I will just, maybe I've been hearing him mention mutation. So some people may not understand that word. So mutation simply means a change, right, from the normal. So these organisms change from their normal configuration and acquire an abnormal configuration that does not respond to the medication.
Okay.
Yeah. So another thing that I want to add that causes resistance is use of counterfeit drugs. So there are a lot of counterfeit drugs out there, and these drugs, I don't know whether they are not regulated or what the cause is, but you would see that someone has taken the correct dosage or the prescription as he's supposed to take, but then the person is still not getting well, or the person is not getting the adequate dose, the adequate treatment. So some lab research has shown that some drugs actually have lesser amounts of the dose of the medication they are supposed to have. For example, if you're supposed to take ACT maybe 120 milligrams, and you get a fake drug that has maybe only 80 milligrams in it, you know that even if you take the whole 3 days treatment, you're not going to get the adequate dose that you're supposed to get. And so these parasites will not get that amount of dose that is supposed to kill them, and so they will just be injured, and they will develop that change in configuration, which will now lead to resistance. So again, counterfeit drugs are out there, and people should be aware of that.
Yeah, true. Okay, we have callers already on the line, 0812-588-6048, and we'll get to hear what they have to say. Hello, good morning.
Hello, good morning.
Good morning.
Krankes Kadung, calling you from Pushit,
Okay.
aka Majority Leader.
Krankes, let's hear you.
I want to appreciate the effort of our guests this morning for this very good, great enlightenment. I want to appeal to our people. We should clear our drainages, waterways, make sure we didn't allow water to stay around your compound. And then people should go for checkup regularly. I was once go to JK Hospital in Jos. They have special doctor there. You see doctor before you go and collect your medicine. So people should try as much as possible to go for their proper check-up. And I heard doctor talking about counterfeit drugs. What are those drugs? So that people should know. And then what about us that we have wells in our compound? The more you open the well, you discover that there are so many, plenty mosquitoes there. Want to appreciate your effort. Keep what they are doing of PRTV. Love this show.
Thank you, Krankes. Krankes is talking about prevention. He's talking about checkup and the issue of counterfeit drugs. And of course, our wells, do they contribute to spreading the mosquitoes that actually give us malaria? Okay, so the doctors will respond to that. Hello, good morning. Hello.
Very good morning, ladies and gentlemen and ladies. Good morning.
Good morning.
Mr. Gao calling from TCNN.
Okay, Mr. Gao, it's been a while.
Yes, I've been away from radio for quite a long time, but I'm back. Good morning, everybody.
Okay, welcome back.
Good morning.
Thank you so much. Let me go straight to the point. Let me start by, I have some questions to ask our gentlemen in the studio. There's this myth that once malaria parasite entered you, it's incurable. It can be subsided, it can be controlled, but you cannot cure it totally in human life. How true is that myth? Secondly, herbal has been helpful to us in the past when our forefathers, they use herb to cure people and all whatnot. What is your perception and what is your concern about herbal medication? Of recent, Ghanaian have adopted that and they have pharmacies that deals with herbs. Are there herbs that is helpful in curing malaria, and what is your take on it?
Okay.
And finally, malaria is a deadly disease, and they say it's a dangerous disease, so to say. They say malaria plus can cause mental disturbance to somebody. How true is that? But we need to clear the air on this. Thank you. Good morning.
Okay. This would definitely be cleared for you. Appreciate you, Mr. Gao. Thank you for calling and welcome back. 0812-588-6048 is the number to call. Hello, good morning.
Good morning. How are you?
I'm fine.
I'm Peace Ambassador Kenneth Lamerle from Boys Secondary School, Gindri, Radio Senator.
Okay, Ambassador Caleb, go ahead.
This malaria prevention is very important to us. And how I wish this malaria prevention education should be moved to the school to school and church to church, mosque to mosque, so that it will help us. And besides that one also, you discover that the mosquito net was given to people in order to prevent or control ourselves. So at the end of the day, the mosquito net is now used for preventing plants on the farm. Then how these people, we need to talk to ourselves to leave these activities. Mosquito net are given to us free, and now we go to the farm, we see mosquito net all over the places. So we need to avoid this type of activities. And students too, we need education because know that they are in the hostel. The use of net in order to control these problems is very important. So they can move to school in order to educate the students and other organizations and church and also most. Thank you very much.
Okay, thank you, Ambassador Caleb. We appreciate your contribution on the program. Let's see if we can pick one or two more calls, then we'll get back to the doctors in the studio. Hello, good morning.
Hello.
Hello, good morning.
Hello, good morning.
Thank you for joining us on Good Morning Plateau.
Thank you. This is Monday Cheskum from Panyam.
Okay, Monday, go ahead.
Yes. May we know how do female Anopheles mosquitoes get infected? Where do they get infected from?
Okay.
Thank you very much.
Thank you. How does it get infected to even infect a human? Okay. All right. Thank you so much, Monday, for your question. Okay. Let me see if we could pick this. Hello. Good morning.
Good morning.
Thank you for joining us.
Good morning, our two guests in the studio.
Good morning,
sir. Thank you.
I am Emeka calling you from Bachinko Jibar Kindadi.
Okay, Emeka, go ahead.
Thank you. Most especially as I, Emeka, before I enter inside my bed, I can enter inside the net. And why? The question, why? If you enter hospital, you are having a malaria order or something, and every day they can tell you you are having malaria. Is it this malaria having vaccine or how? I don't know. Please, I want to know the question.
Okay.
I hope you get me.
Yes, I'm sure they got you. Yeah, we got you. We got you.
Thank you.
Thank you. Okay, so back to you in the studio, doctors. You've heard all the questions from our callers, so let's get to have the answers to the thoughts of the listener. Okay, I'll start with you, Dr. Chanshilip.
All right. So thank you very much for those important questions. I want to appreciate the first caller who talked about clearing our drainages and pools and whatnot. That is very important, and we emphasize that people should sanitize their environment. At this point, I want to appreciate the Plateau State government under the PEPSA, the Director General, who is Samuel Dapia, who has been doing very well with sanitation of the environment. And so, going forward to answer the person's question, which was on what are those counterfeit drugs? There are a lot. I won't be able to call names of drugs on this show. So what you need to do is just Google it. There are just Google counterfeit malaria drugs by NAFDAC. You'll see a list of drugs that have been tagged counterfeit by NAFDAC. And also, when you buy a medication, mostly there are these scratch and text codes that they normally put there. Yeah, so you can scratch it and text it, and if it's counterfeit, you could see it. Yes, so you can use those to check also. And then someone said there is a myth out there that malaria is incurable. I want to categorically mention that malaria is curable. Right? Malaria is curable. So, and if you use the right medication, you're going to be cured of the malaria. So it's not like hypertension and diabetes that are incurable, and so it's curable. Yeah, so I think that answers his question. And I think I'll just join it with the last caller who says whenever he goes to the hospital, always they say he has malaria.
After taking all precautions. So when you say all precautions, what are all precautions? Because I'm sure you talked about sleeping under the net.
So that is just one, right? So you see, another thing that we notice or we didn't talk about here is that people go out in the evening to gist, have stories and all, and they expose their legs. Most of them, some people go out with shorts, some don't even wear stockings and all those things. So one of the preventive measures you take, even for your children, is that during the evening times where we know that mosquitoes usually, have more of their activities, you're advised to wear long sleeves, trousers, long sleeves and all, and even cover your this thing with stockings, right? So that you avoid or prevent yourself from being bitten by mosquitoes. So this person may be sleeping under the mosquito treated net, but how about outside, maybe in his shop and all in the evening? Does he wear socks? Does he wear long shirts and long trousers? So those can expose him also. And also we could use mosquito repellents. There are mosquito repellents. Yes. So if you don't want to wear all those long trousers and long sleeves, you can use mosquito repellents, and then it will help to repel the mosquitoes. So I don't know, maybe I will just share my perspective on herbal use, and then I'll allow my colleague to continue. There is this analogy I always ask people whenever they ask me a question about, we've been using, our forefathers have been using herbs, and then, can we use herbs for any condition at all, not just malaria? So I ask them something. The question I ask them is, can you take your car to the fueling station and then tell them to put crude oil into your car? Crude oil. Crude oil has the different components. Has kerosene, diesel, petrol, and all. So would you carry crude oil and put inside your car? They will say, no. What will happen? They will say it will knock the engine. So it's the same thing. Most of these drugs are actually gotten from plants and herbs and barks of trees and all. But then they are not refined. You understand? So they are a kind of crude.
Yeah.
They may have the good ingredients or the active ingredient that helps in curing the disease, but they can also have toxic ingredients that you don't need in your body. So when you're taking the herbs, it's like you're taking crude oil and putting it in your fuel. You're taking things that will shut down your kidneys. You're taking things that will shut down your liver, because everything will be processed by your kidney and by your liver, and then also they may be excreted by your kidney as well. So I think I'll stop here.
Okay, so maybe Doctor will just answer this one. I think you have done so well, Dr. Chanshilip. So Dr. Jehu, maybe you would answer, how do mosquitoes get infected to even transfer it to humans?
Okay, thank you.
Of course, the issue of the mental disorder in malaria.
Mental disorder.
Yes, I think it was Mr. Gao that asked.
Okay.
If
Yeah, the
malaria.
second part of his question said, Abi?
Yeah, I think he asked about
okay, he has
mental.
been answered. Now, where do mosquitoes get the where the anopheles, the female anopheles, right? Now, a mosquito is a vector. It just carries it. Okay, vectors are animals or insects that carry diseases. Okay, it just carries it. Just the same way dogs carry rabies.
Okay.
The same way
Rats
carry Lassa fever. Okay, and then they may get it from humans. Okay, remember that it is a cycle. Okay, when they bite and the person is infected, they pick it from the human. This mosquito, this anopheles, has life cycle, and part of the life cycle is in the human body, part of it is outside. So when they bite, in fact, they need to bite you for the successful reproduction to complete.
Yeah.
Okay. The other question, mental illness. Now, I would not say malaria would necessarily cause mental illnesses, but of course, understanding that malaria is a systemic disease. If it damages the kidney, toxic substances are going to accumulate in the body, and they are going to be toxic, and then they would cause the person to talk irrationally. Okay, we call it encephalopathy. If it damages the liver, same thing will happen. Okay, when you cure it, you cure the damage or the organ that is damaged, the mental illness will stop. Okay, so it's not necessarily, unlike in typhoid, where typhoid has psychosis, where specifically the illness causes psychosis. Malaria does not have a direct psychosis. Then the last person was asking about vaccine for malaria. Yes, there is vaccine for malaria, although not readily available in Nigeria. The last I know of it was a tranche was supplied to Nigeria, specifically Kebbi State and Bayelsa State, and that was in 2024. So far, I have not heard anything yet, but of course, yes, there is a vaccine for malaria. And for those who have wells, please cover your wells. Okay, cover your wells very well, and then involve in sanitation. Join the government in sanitation. Thank you very much.
Thank you very much. This rainy season, don't give mosquitoes a home and sleep under a net. Keep your environment clean. Test before you treat. For fever, visit the nearest health facility for treatment. We appreciate you, Dr. Jehu and Dr. Chanshilip, for your time this morning, and to the executive producer, Rita Kachalon-Pam, the producer of today, Enna Ramo Daniel. Thank you from Veritas University, and of course, the engineer is Alex Aziz. From the ICT, we had Adati Seth and Rohi Danjuma, and from the newsroom, I saw Nenrod Ruang. Thank you all for being part of this show today. To all the ICT students, IT students, I beg your pardon, from Plateau, Federal University, Kashere, and Nile University. We appreciate all of you. Until we come your way again, see you.